Very good evening to all of you who have joined in today for ConneXions, the fifth webinar series. The stark choices in a COVID-dominated world, why interdisciplinarity is indispensable now. I'm Dr. Neeraj Mankad. I'm going to take you through. We have our speaker for today, Professor Ananya Mukherjee Reed, who is on the board of studies Flame School of Liberal Education and is also the provost and vice president academic of University of British Columbia, Canada. And hosting her is our dean Flame School of Liberal Education, Professor Santosh Kurtarkar, a master's in physics from IIT Madras and a PhD from Institute of Mathematical Sciences. He's been associated with Flame since its inception. Santosh, I would like to hand this over to you. Over to you, Santosh.
Thanks, Neeraj. One of the essential elements of Flame's education and Flame's philosophy has been interdisciplinarity. Right? Ever since we conceived and designed the curriculum since the inception of the institution, we have always believed that disciplinary boundaries are one human construct that should be broken as soon as possible and as quickly as we can. Right? A pandemic, given the unprecedented times that we are going through, the pandemic is the right place for us to break disciplinary boundaries. If you have noticed, following the news about the pandemic, you would have noticed that not only the doctors and the scientists are giving their opinion, your most trustworthy resource for reliable information is coming from economists, who are applying the skills that they had to deal with, counting money, as so to speak, to counting the number of cases and how things are, at what rate things are moving. Right? There are psychologists because for the emotional and mental toll that this is taking on over all of us. The statisticians, for a change, are in the backdrop. And physicists, the most successful model for the Indian prediction for the number of cases has come from physicists. And who would have thought that that physics would have something to do with a pandemic in the first place? Business leaders, lawyers, psychologists, virologists, epidemiologists, to a small extent statisticians, whereas they had to be at the forefront. Political scientists are all there, trying to address this. And one of the characteristics of that second decade of this 21st century is complexity, right? One of the educationally, we are all trying to create students or graduates who can deal with complex problems, where they're not overwhelmed by by the complexity of the issues that surround them, and they're not looking for simple solutions. Complexity and uncertainty requires interdisciplinary solutions, and this is where the ConneXions series was built in. And just if this corona pandemic is a time for reset, then it's a right time for us to revisit and rethink what interdisciplinarity means. So towards this end, we had a series of talks, and this is the fifth in the series, and we have no better person than Professor Ananya Mukherjee Reed to go through and explain to us, right, what interdisciplinarity in the public policy space means. I'll just give a brief introduction to Professor Ananya Mukherjee, and she has been a well-wisher since a long time, ever since, and I think she readily agreed to have this, deliver this talk to a general audience, not only to a faculty and students, but to a broader audience. So I'll just briefly read about, tell you about Ananya's, background and qualifications. So Professor Reed is currently the Provost and Vice President at UBC, Canada. She is also a professor of philosophy and political science at the Irving K. Barker School of Arts and Sciences. She's an interdisciplinary scholar in the field of development studies. Her work has mostly concentrated on inclusive and people-centered development. She has worked extensively with the United Nations on their sustainability goals and of course in the role of universities as agents of social change. Prior to joining UBC in 2018, Professor Reed was at the at the York University, and was the Dean of the Faculty of Liberal Arts and Professional Studies, which is very akin to Flame. When she visited us, there was so much similarity between her school and what Flame was doing, especially the Liberal Arts and Professional Studies aspect. During her time at York University, she also served as the Vice President of Research and also was the chair of the Department of Political Science. She also established the Institute for in the International Secretariat for Human Development at York University. Of course, in 2016, in November, she was named as one of the 5 brilliant women in academia by the Canadian Immigrant magazine. I would like to take this opportunity on behalf of all of you to welcome Professor Ananya Mukherjee Reed and thank her for agreeing to give this talk. So the way we'll progress is Professor Ananya will deliver her talk, and then I'll be moderating it. If you have any questions, the Q&A box on the Zoom app is what you have to use, not the chat box. I'll be moderating given the limited amount of time and the number of participants. I think I'll be moderating what is relevant, and Professor Ananya has a long day ahead of her. So I'll maybe after a 35 minute talk, and we'll take questions for the next 20 minutes or so. So I hope that works for all of you. Over to you, Professor Ananya.
Thank you so much. Thank you for that very generous introduction. I'm actually delighted to be able to do this talk and share some thoughts on interdisciplinarity at this very, very difficult time. Let me tell you just a little bit about where I am. The University of British Columbia, it is one of the 3 largest universities in Canada, and it has about 65,000 plus students right now. And I am on its 2nd campus, which has just a little bit over 11,000 students. So the original campus, which is in the city of Vancouver, it's by the ocean, as you know, and it's 100 years old. And the campus where I am is in the Okanagan Valley by the Okanagan Lake. And it is 15 years old. This year is in fact our 15th anniversary. And we call it UBC Startup Campus. And our approach is very much like that, to get things done and think through things in a different way. And we've been very fortunate to have a group of very bright and committed people, faculty, staff, and students, to take us on this journey. And interdisciplinarity is really a big part of the way we work here. So let me try to share my screen and get through the presentation, and then I really look forward to your questions. So the title of the talk is why interdisciplinarity is indispensable now. It was indispensable all the time, and it isn't, the thoughts about interdisciplinarity are not new, but there is a new urgency, I think, that we all need to respond to. So the outline of my brief presentation is I want to go through these subtopics. First of all, just reflect a little bit on really the immensity and the multidimensional nature of the crisis, its impact, the solutions and decisions, particularly how we are thinking about the vaccine and the economy. And in that context, talk a little bit about interdisciplinarity and its relevance. And then ask ourselves, what is the way forward? And the way forward is both very simple and difficult at the same time. So that's what I would like to put before you when I end. So the crisis really is a crisis of all of these dimensions. It was a crisis of knowledge. It is still a crisis of knowledge. It's a crisis of life. It's a crisis of livelihoods, the state, crisis of voice. We know that A lot of people are not being served because we don't have systems and processes through which we can actually hear of their suffering. It is a crisis of leadership. It is a crisis of human relations. It is a crisis of faith and spirituality. It is a crisis of mental health, and it is a crisis of empathy. And probably the last one is what bothers us the most as we hear and see what we hear and see on the news. And so when we take all of this together, it is really a crisis of our civilization. And as I was thinking through this, I keep remembering the title of Tagore's famous essay called The Crisis of Civilization, which is, I think, the last essay he delivers before his death, soon after. And he is expressing a deep disappointment with actually the liberal values that he thought would be able to rid the world of the oppression of colonialism. And he's saying that, I'm not sure that I believe in that anymore. But in the end, he says that, but I'm not going to lose hope, because it is a sin to lose hope in humanity. And I think that's really where we are. We have to work through what we have, but we cannot lose faith in humanity, in ourselves. Now, when we look at this immensity of the crisis, the question that we cannot avoid is, should we have seen it coming? And I put this in front of you. I don't have an answer, because we hear the word unprecedented a lot. And of course, medically, scientifically, the virus is perhaps unprecedented. The way it started spreading is unprecedented. And what we had to do to combat without having a vaccine is unprecedented. But the crisis of lives and livelihoods of hundreds of millions of people were already there. We just refuse to see it. If we just look at the hundreds of millions of people who suffer from food insecurity, that crisis was already there. So I think when we go forward, we need to think about what we did not know and what we could have known, and build our defenses on what we had known, which may have ameliorated the impact of the crisis on some people. So the impact, the impact is huge, and all of us know about the impact because, we are glued through our many channels of information. But in the next couple of slides, I just want to go through a couple of things and just consider them together, just to understand the immensity of the impact. So the global per capita income is expected to fall by 4%. It's expected to put 40 to 60 million people into extreme poverty, in addition to people who were in poverty already, with sub-Saharan Africa and South Asia the hardest hit. Half of the working people could lose their jobs within the next few months, and the virus could cost the global economy something like 10 trillion. 265 million people will face crisis levels of hunger unless direct action is taken. And crisis level of hunger is one notch beyond what some people are already experiencing in terms of food insecurity. This is a graph that shows the immensity of the crisis. This is just in the US, but it is a comparison of the impact on unemployment between the Great Recession, which happened in 2008, 2009, and the impact of COVID in just 2 months. So the light blue curve is the Great Recession, and the almost steep line, the deep blue steep line, is what has happened between February to April 2020. And there are about, this came from an article in the Business Insider based on US labor statistics. And there are about 5 of these charts which show this steepness of the impact, the ruthlessness of the impact, even compared to the Great Recession. On K-12 education, UNESCO estimates that 1.38 billion children are out of school worldwide. And you have seen the additional impact that has on households, on children who are dependent on breakfast or other midday meals for their sustenance, and the devastating impact that has had on children who have are disconnected or cannot get those services that they normally get. The impact on universities, and this is only the US and UK, the impact is much, much greater. So the American Council of Education projects an overall drop in college enrollment of 15% for fall 2020, including a 25% decline in international student numbers and an expected revenue loss of something like 23 billion. And this is also affecting particular kinds of institutions more. You may have seen that particularly liberal arts education, small liberal arts colleges, there are a lot of concerns about what would happen to that kind of educational institution. In the UK, the Universities UK estimates the financial impact has already reached 790 million pounds for the country's institutions, including the revenues lost in the form of accommodation, catering, conferences, and all the student support. And remember, all of these activities of the university are also employment generating activities. So in a place where I am, for example, if the entire tourism and restaurant sector closed down as it has, the university remains the only employer. And there are severe local and regional impact for a university not being able to deliver the services that it normally does. The deaths, I just wanted to dwell on this a little bit, just about how it's affecting different groups of people. So this is the famous New York Times cover that you may have seen, where it put the names of the close to 100,000 people who are believed to have died. And it is an incalculable loss, to say the least. We can't even comprehend the immensity of the deaths in one place. A very heartbreaking development has been in the US and Canada about the deaths in the nursing homes where a lot of the elderly live. In Ontario, where Toronto is, where I lived for 23 years, yesterday, the military had to come in and trying to intervene to get some control over the spread of outbreak and the deaths in the long-term care homes. So in Canada, their one estimate is that 82% of the COVID-related deaths are in the long-term care homes. And in the US, it could be as high as 50%. And there is not even enough data. In the US, we've heard stories of where private nursing homes are not actually comfortable giving the data of those who are dying. And there you may have seen the heartbreaking stories of where the relatives, the children, the grandchildren cannot actually go and visit those who are dying because of the spread, fear of the spread of the virus. So this raises absolutely fundamental questions about who we are, what our relationships are, what we're doing, and how we organize our societies about it to respond to the needs of particular kinds of vulnerable people. Again, in the US, and this is true of everywhere, in the US, one piece of data that has been talked about a lot is the proportion of the Black population who are dying disproportionately. So this is a list of US cities where you will see that Chicago, for example, where the percentage of Black population is 30%, but the deaths are 70%. In Milwaukee, 26% and 66%. In Louisiana, 32% is the percentage of Black population, whereas the percentage of death is 70%. And this is what I mean by, when I asked, should we have seen it coming? The disproportionality that we're seeing in the impact, that was there in the social systems and the economic systems that we had. So it is not entirely unknown. And so going forward, we need to make sure that we're taking all of that into account when building our responses. And the poor. This is a photograph very familiar to all of us. It was, I saw it first in NDTV and then it was shared widely on social media. This is the migrant worker who was trying to return home and his 1-month-old son died and he couldn't. And this is just one face that, a lot of us had trouble putting out of our mind, but we know that the problem is much, much larger. There are hundreds of millions of human beings separated from their families, trying to reach home and trying to just make some sense of the very difficult situation that they're in. So what are the solutions? And, around the solutions, there are very complex processes of decision-making. And we are all participants in that decision-making, even though we don't always feel that way. But we have to consciously think of what are those decisions and what we could do. So there are many solutions being proposed, but I've put here just 2 of the very major ones that we are waiting for and trying to understand. One is the vaccine, and of course the medical community is divided on what to expect, when to expect, and how to prepare. But what we know is the scientific discovery alone is going to be necessary, but not sufficient. There are other crucial decisions surrounding the scientific discovery, which will impact people's lives. So who will get the vaccine? We don't know yet in what proportion, what quantity, who will produce it. So who will get it? Is it a child or an elderly person? Is it going to be available to those who can pay? Or is it going to be available to those who can who cannot adequately distance physically because they are more vulnerable? Which country is going to get it first? Is it the US? Is it France? Or is it everyone? And of course, we all know intuitively that, for a vaccine to work, we need to get it as widely available as possible. But how do we do that? There is a line that we've come to learn through this pandemic is that no one is safe unless everyone is safe. But how do we make that happen in our current systems of thinking and policymaking and political economy? Then the other big area of decision is the economy. So, this is our everyday question: lockdown or return, and who does it impact and how? What should we protect, the organized sector or the informal economy? Which loan should we write off? In the US, the student loan is in the $1 trillion magnitude. And a lot of students, young activists are saying that this cannot possibly be true, that at a time when knowledge is so essential, that there is a system that blocks us out because of student loans. Or small and medium enterprises, because those provide the majority of the employment. And what kind of stimulus should we provide? To who? Should it be direct cash transfers to the poor, or should it be something else? So these are now debates surrounding our everyday life. And you will see that we continue to experience these questions as this either or. And this is where the thinking is not holistic enough. And that is where I feel that interdisciplinary thinking is most essential. So what kind of knowledge is required to make these decisions? The relevance of interdisciplinarity. This is where I want to focus the rest of our time. What kind of interdisciplinarity? Let me go back to the previous slide for a second. When we think about interdisciplinarity, we think basically of different disciplines getting together and finding new forms of knowledge, either by borrowing from each other or creating a fusion. And there are huge and long debates on interdisciplinarity, multidisciplinarity, transdisciplinarity, etc. I am not bringing any of those debates to you today. I don't think this is the time for that. I want to talk about interdisciplinarity in a slightly different way as to what is the substance of an interdisciplinary approach. So for me, I have laid down a few, but for me, the first two are the most important. And let me just read them out and then elaborate a little bit. So the first is that when we begin on a knowledge production exercise, or when we start with a question to which we are wanting to find a solution, any of those questions that I mentioned before, we begin from an ethical commitment to the collective or to the public good. So it's not about which discipline, it's not about how sound my analysis is, it's not about how great I am as an economist or a social scientist or a political scientist, but it's about what is my ethical commitment. And this is extremely important because a lot of the research on interdisciplinarity will say that it fails because people come together, yes, they learn a little bit from one another, and then people tend to return to their own silos because that's how they have trained and they've been trained, and it's very difficult to actually get something of substance out of an interdisciplinary approach. And this is because I think the commitment, which is not about any discipline or any approach. The commitment is about the ethical commitment to the collective good and using whatever resources we have to fulfill that commitment. That, to me, is the primary basis of the interdisciplinary approach that we need now. The second one is to prioritize a goal which is external to each of those disciplines. So we all need to be rigorous in our analytical and scientific methodologies, and every discipline will have some requirements around that. And when we come together across disciplines, we can develop a set of requirements around the rigor and the methodology. But we need to then, but before we do that, we need to get together and prioritize a goal. And this is actually happening in a lot of new approaches to, well, not even new, a lot of the approaches to medical science or healthcare, which is, called the team care approach, where you have different specialists, there's still specialists, from different fields of medicine get together to deliver on a particular, to work on a particular patient. And the goal is patient well-being. Similarly, the goal could be reducing vulnerability, or the goal could be, human ecology, for example, is another field where the goal is the building a future where humanity and the environment come together in mutually reinforcing ways and not destructive ways. So those two, an ethical commitment to the collective good and prioritizing a goal which is outside of any of the analysts and outside of any of the disciplines, but something that is focused on a goal of, transformative goal, a goal of well-being. Those two are the most important criteria. And that is the glue. The research which says that interdisciplinarity brings people together but doesn't go further, it sometimes just leaves things undecided. That can be overcome by actually focusing on why, bringing back the value question. Then there are some ways in which interdisciplinarity engages us to act, which is interdisciplinarity celebrates breadth and complexity. We are not asked to compartmentalize. We are not fearful of complexity, but we actually engage with breadth and complexity. Then we challenge interdisciplinarity, asks us to challenge the habits of thought and privilege. And you see that the habits of thought dominating a lot of the policy discussions right now. I mean, my own field is economics. You can see that, Amartya Sen has been saying this for a long time. But I mean, some recent interviews, he has talked about economics needing a moral reckoning and connecting it back to what many people think is the origin of economics as a moral science, right? But in order to do that, there is a privilege built into some of the disciplinary discourses and some habits of thought, which interdisciplinarity allows us to challenge the interdisciplinary approach. And the next one, proactively acknowledge the limits of knowledge. There's probably nothing more important than that at this current moment. That if we are all to find the best solution for the goals of collective well-being, then acknowledging with humility the limits of the knowledge that we each bring to the table is extremely important. And this needs to be built into whoever we teach, do research. And unless we acknowledge the limits, we can't seek out others to help us overcome those limits of knowledge. And the final one is to dissolve the boundaries of knowledge and practice. So it is easy to learn one thing and to do it. And all of us probably can do one or two things very well. But this is not the time to just do what we are comfortable doing well. This is the time to really defy boundaries of knowledge and practice. And when I put these things this way, it might seem that these are abstract ideas, but they're not. And there are, fields of practice where these are being practiced. So medical science is one, team care, nursing practice is another one, leadership. There are the questions of leadership at every level, be it business, be it political science. All of those are now questioning the established ways of doing things, and and it all requires us, each of us being challenged, each of us having the boldness to challenge others, and this makes for some difficulty, some uncertainty at a time when people are already going through a lot of uncertainty. So we need to think of this very self-consciously and embed this in all our activities, be it whether we are a university, whether we are a hospital, whether we are a government, or whether we are a business. So this is, again, taking from the field of healthcare. You can see that the factors influencing health are the researcher is identifying 8 classes of factors, which can go from family biography to absolute and relative poverty to national and local policies. And remember, these are classes of factors. So within each of this, there are important sub-factors which actually determine what a person's health situation is going to be. And we have seen this in our current pandemic over and over again. We started out by saying that it only affects the elderly, then we said it affects people with certain comorbidities. Then in some places we're saying we really can't say that because we've had some very young people being affected by it. So what all of that brings to the fore is there are unlimited number of factors that determine how a person is going to survive or not. So this kind of complex idea, celebrating complexity, questioning dominant patterns of thought, and opening ourselves up to really the breadth of education. This is not a new idea, certainly not in India. And I want to take you back to the first report of the University Education Commission, which is setting up the universities in India. It's a commission chaired by Dr. Radhakrishnan. And I just want to read you 2 paragraphs from it. And then Dr. Radhakrishnan also goes on to talk about how medical education and engineering education should be set up. And his idea very much is all of those fields which we consider to be professional fields must be grounded in a broad interdisciplinary value-based education. So this is from the first report of the University Education Commission in 1949. And Dr. Radhakrishnan says, the purpose of all education, it is admitted by the thinkers of East and West, is to provide a coherent picture of the universe and an integrated way of life. We must obtain through it a sense of perspective, a synoptic vision, a samannaya of the different items of knowledge. By the way, I don't know if there are students or members of our younger generation who might not know who Dr. Radhakrishnan is. This is an extremely good Google opportunity. Do look up Dr. Radhakrishnan. It's somebody who's is a very prominent figure in the history of Indian thought, and it's important for us to know about him. And then he goes on to say, man cannot live by a mass of disconnected information. He has a passion for an ordered intellectual vision of the connection of things. Life is one in all its varied manifestations. We may study the factual relationships of the different manifestations, but we must have knowledge of life as a whole. It cannot be a collection of distracting scraps, but should be a harmony of patterns. The subjects we study must be taught as parts of a connected curriculum. You know, the idea of distracting scraps of information and disconnect, we are all struggling with that right now. There is so much information, but the connection is what we are struggling to make. And that connection is extremely important for us to contribute to the knowledge in this post-pandemic world. Just one more paragraph on leadership, because when he's talking about universities, he clearly sets out what is the role of the university, is to create leaders. And he doesn't mean that in an elitist sense. Remember, that is a moment of great nation building. So they're expecting to create leaders from the ranks of one and all. So he says, we are building a civilization. The quality of a civilization depends not on the material equipment or the political machinery, but on the character of men. I think he meant to include women as well. The major task of education is the improvement of character. Education must carry out at appropriate levels a combination of general, scientific, artistic, and technical education for students of varying abilities and occupational objectives. And this is a theme that runs through the entire report. This is a theme we hear in Tagore a lot of times when he's talking about setting up Vishwabharati in Shantiniketan. He's talking about the absolute importance of having this connectedness of information and not this disconnected information. And the same idea we find where this kind of education is not only for leaders, it's for everybody, because they see that great moment of the building of post-colonial India, where everybody contributes to the new India in any way they can, and universities have a role to play in that. So what is our way forward? one thing to remember as we are struggling to the question of interdisciplinarity, that or the question of what kind of knowledge we need in this current world is, yes, if we acknowledge the immensity of the crisis, it's already clear to us that no one discipline can give us what we need. There's already quite a bit of discussion on the overdependence of epidemiology as one field based on which we're making decisions. So the way forward, as I said in the beginning, is both very simple and very difficult. So let me just put it to you and then open it up for questions. This was from the Times Higher Education Supplement actually last night. It's today's Times Higher. And the report says that almost 8 billion, that is 8 billion US dollars, that is about 6.5 billion pounds, have been pledged internationally towards the scientific fight against corona. But might investment outside the medical sciences also pay dividends? Experts want future pandemic research to encompass more disciplines and criticize the reliance on experts from a narrow group of subjects. So yes, and it's happened in Canada already, particularly in the field of health research. There is a lot of call for interdisciplinary research. And there is also a lot of concern among scientists that how exactly is this to be done? Will this succeed? And in the Times Higher a couple of months ago, there was actually, I don't remember who the author was, but a concern that, this is not the time to play with interdisciplinarity. This is the time to come up with very determinate conclusions based on rigorous analysis. And now we see increasingly the express need for pandemic research to be interdisciplinary. So let's say we go that route, we have, US 8 billion US dollars to be put to the use of interdisciplinarity. Under what conditions can these collaborations succeed? That is the question before us. So it's not, I don't think interdisciplinary itself is a question. I think its value is understood, but how will it succeed? It cannot succeed just by throwing money and putting people together. It can only succeed if we prioritize interdisciplinary thinking at every level, in every institution, in every deliberation, in every sphere of life. And by that, what do we mean? I do not mean that at every group you must have people representing every discipline. What I mean is these values. I come back to those values which must be intrinsic to interdisciplinary thought. So the first is the ethical commitment, that we're not committed to our disciplines. We are committed to something larger than that. And some of the thinkers who think about knowledge might argue that that makes knowledge too instrumental, that we're not pursuing knowledge for its own sake. We are dedicating knowledge to a certain purpose. That is a debate we can enter into, but I think we need to not make knowledge be reduced to serve certain particular interess. But we do need to consider how we make knowledge serve the collective good and build an ethical commitment towards that. Interdisciplinarity is about boldness, as I said before. We're not trying to compartmentalize. So when we talk about lockdown or restart, we must fully embrace the impact and the complexity of that decision and the impact. Humility, which is the limitation, an awareness of the limitation of the knowledge I can bring from one discipline. This humility is absolutely crucial. And the value of collaboration, which is absolutely crucial. So when I mean interdisciplinary thinking, I mean those 4 sets of values, and it doesn't matter to me who is sitting in the room to find the solution. It also means that it's a matter of practice. We cannot just talk about interdisciplinarity. So whatever is our field, we need to practice these values in that. And it is happening in many different fields, I think in questions of leadership, in questions of health, in issues of sustainability. We are seeing an interdisciplinary approach which is committed to values. We just need to make it the dominant way in which we conduct our affairs. And of course, I am in a university, and we are all either with universities or connected to the knowledge community broadly defined. And we need to prioritize this way of thinking and actually reward these values of ethical commitment, of boldness, of humility and collaboration, and taking the courage to practice. I end with one of my favorite quotes from Tagore again, that you cannot cross the sea merely by standing and staring at the water. So we can allocate the billions of dollars, we can talk about interdisciplinarity, but the real challenge is to actually practice it, be prepared for mistakes, stumble, fall, correct them. But do all of that within the framework of that ethical commitment to the collective public good and an ethical commitment to serving the most vulnerable. And when I say that, I understand that, there is no one ethical commitment. We will come together at a table with different understandings of who we should serve, who is the most vulnerable, who is the priority. But the other characteristics of boldness, humility, and collaboration will help us have that debate and arrive at an ethical commitment. And there may be different commitments in different groups, but that would be our guiding principle. And then we will slowly but surely cross the sea. So I will stop here, and then I will open it up for question. Thank you.
Thanks a lot, Professor. So let me shoot the first question. Right.
Okay.
What do you think is the biggest stumbling block in adopting an interdisciplinary education in universities as big as yours and in institutions as small as ours? Right.
Well, the actual campus where I am, it's actually not it's not as big as many other universities. The stumbling block is, is in our habits of thought. So we have organized universities around disciplines. And so to understand now that let's change the very principle of our organization. That is the concern. And sometimes, we also have to speak to broader society. We can't just say interdisciplinarity is good for you and we are going to be interdisciplinary. We have to argue what the value of that is. So for example, for a typical student, the question often is if I do a major in minor and I have an interdisciplinary degree, how is that going to affect me in my career? And the answer has to come in part from the university, but also in part from society, from employers who will say, yes, we value this because we want our enterprises, our businesses to solve a bigger problem and not just bring to us one solution of a small problem. So it is, the challenge is really in the habits of thought in the different sectors of society. We all need to come together and understand what the value of this is going to be.
So that comes with a follow-up question that an attendee has asked.
Mm-hmm.
How about a marriage of humanities and STEM? The fact that we are educationally in education institutions have siloed the disciplines so much that there is tribalism among academics. There is a lot of turf protection. The economist doesn't want to talk to the other social scientists because they think they have a set of skills and the others don't, and as an economist yourself. But then given the current situation and given that we are in the 21st century, why don't we marry when the attendee is asking about humanities, this is non-STEM and STEM together in a holistic kind of education, right? An engineer should know as much about humanities as anybody else.
Yeah, so there is no option. I don't see this as an option. We just have to find a way to do it. So, if anything that this pandemic has taught us is what turf are we protecting, right? So yes, the disciplinary turf, but let's change the notion of the turf itself. So if we go back to what is the purpose of knowledge, right? When we see the suffering that we are seeing right now, that's the turf, right? So let's not think of any small turfs anymore. Easier said than done, yes. But if there is any moment to understand how united and how interdependent we are, right? Let's really do that, let's really take that reckoning, as Amartya Sen has said, that this is a moment of reckoning, right? So, I talked to you about the death in the nursing homes, which is really people's parents and grandparents. And if you think of all of the decisions that need to go in there, there is no one discipline in the world that can resolve the complexity of human relations, of familial relations, of public health care, of disease containment, of mental health, of care of the elderly. If we think that this is a social priority, that we will not let our parents and grandparents live and die in that way, if that's the turf, then there is no choice anymore but to bring in whatever we need to bring in to serve that question. So, and I feel that universities have, well, I obviously feel very passionately about universities, but leaving that aside. So, because we are directly in touch with the second generation, or the next generation, right? The next few generations. So if we can take out this notion of the turf from their mind before it becomes too entrenched, then we've already done something. So let's try, of course, the marriage of STEM and humanities. In some cases, in engineering programs, engineers do have to take courses in ethics and sustainability to understand their future professional responsibilities. But it's still a little bit ad hoc. It's still a little bit plus X plus Y, but it is the transcending the X plus Y where we have to get, there's a beautiful quote from Rumi, which says that those who understand the one think they understand the two because they understand the one, but they also have to understand the and if they want to claim one and one makes two. It's a very profound, typical Rumi statement, but yes, it's the and we have no time to lose right now.
That comes up with a follow-up question, which I don't know whether it's Miss Chaudhary who has asked this, right? When we talk about interdisciplinarity and in the educational setting and making, breaking these silos for our students, right? They're obviously, they're not going to spend all their lives in academia. Very few of them get into academics, and there is a job and there is a real world outside. How do employers appreciate interdisciplinarity? Because one of the things that I noticed that the COVID thing has raised is the importance of skills, that are required for doing the job right now, right? These are the specific set of skills. This is the apprenticeship that we used to have many years ago. There's not broad-based skills. How to build a website, great. I can give you a job right away. Why do you want to spend $80,000 per annum on a college education? Whereas, you could be earning as much. There is a certain opportunity cost that builds in. So even if the institutions, the question is here broadly about what is asked of liberal arts, that, are you making students jack of all trades and master of none, whereas the employer may be seeking a very specific skill? How do we, ensure that, the other side who are giving these jobs also appreciate this point of view?
So 2 questions. So first of all, two answers. The first question is, do employers appreciate? So the first answer is, universities are creating the employers of tomorrow. So we start now. That's number one, right? We start before we start as soon as we can, basically. That's one thing. But, actually in British Columbia, in school curriculums now, they have introduced design thinking. And what they're saying is competency-based curriculum. So I don't only want to know how well you have learned math and science and the arts. I also want to know what you can do with them. And have you learned the skills of collaboration, of etc. So some specific competencies. So one question is, we start now. The second is, when you say that do employers appreciate? Employers are not a monolithic group, right? And employers are people who are who need solutions. If the value proposition is, I have learned to do physics and political science at the same time, then the employer might ask, okay, so what can you do for me? But if the value proposition is, so for example, right now, the small business employers, so, in every city that you look at, small businesses are shut down, right? Nobody knows, and that's a huge employer everywhere. There was this story about just New York City alone, where 30,000 small restaurants have closed down, and the employers are trying to find, those restaurant owners are trying to find different ways of delivering foods to frontline workers, or all kinds of things they're trying to do. So they'll need solutions. So if we are producing graduates who can provide solutions in this extremely complex situation, then that's the value proposition, right? And I hear a lot from employers who are saying exactly that I want to find, I don't care if you studied history or math, I want to know, I had to lay off X number of workers. What can you tell me that enables me to bring back at least half of them and restart my business? That's the question they need to answer. So if we train our students to in those values, which is, and I don't mean simply what is called, a problem-based approach. I really am more focused on the value, not just a problem. What is the societal value your action and knowledge is going to create? So and we have to start this discussion also that, that are we actually training people to solve these problems? But there's no time like now, because I think employers are realizing, all of us are realizing, the complexity of the problems we need to solve. So this is the time to challenge people who are saying you're producing people who are masters of none. And the only way we can do it is by producing people who are masters of problem solving with the value-based approach.
Yeah. So that so I'm picking up questions on certain themes. So I'm going to ask to Professor Ananya Mukherjee Reed, the developmental economist right now, right? So, this has been a decade of massive technological disruption, right? There is, things are getting automated at a scale that was unimaginable. Now, the COVID has aggravated it in terms of migrant labor and shutting down of businesses. And, at least in India, the MSMEs are not able to reopen because all the workers have gone back to safer places, to their hometowns. The question that is asked is, should we continue the thrust on efficiency and automation and risk job redundancies right now. And it has got very severe ethical implications, right? At least for a developing country like us. So what do these people will do otherwise? The masons, the skilled workers, or the semi-skilled ones, right? If everyone moves towards automation, even in the agricultural sector, what was being done by hand, if they bring in industrial level farming like they're doing in the West, what happens to these jobs out there?
Mm-hmm. So the problem is not only in India, right? The problem is global. But I like the way you phrase the question, should we continue? But normally, if we look at most of the articles on AI, for example, at least in the popular media, is AI is going to wipe away X number of jobs. Then they will give a list. See, is your career in this? And it creates a constant, it really affects young people to constantly be told that there is no future for you, right? And what it does is takes away that agency which you put in the question is, should we or should we not? Which means that it's an open question which needs to be answered in response to its human impact. So technological advances can happen, but how we use them and how it impacts people is in our hands. We are not without agency in that, right? So again, going back to should we, that first of all, we need to acknowledge it's an open question. And then, yes, of course, there are questions of businesses will disappear if they don't do X, if they don't do Y, and there'll be only 3 monopolies which will dominate the entire world, entire industry. Well, these are all outcomes of human action. They don't happen by magic. There's no there's no supernatural force which is making these happen, right? So again, what this COVID situation has brought back to us is, yes, the virus came and forced certain things in terms of the containment. We didn't have a vaccine, so we had to do the physical distancing and etc. That was our first approach. And then it has opened up all these questions of where is the human impact and what do we do? So I think absolutely, the question is not, do we do AI or do we not do AI? The question is, how do we harness the benefits of technological impact for most of our fellow citizens? That's the question, right? And you will see that in many places, the question on AI is now treated as an interdisciplinary question. So Oxford, for example, I think its largest AI research activity is in the humanities, looking at the question of AI and humanities. So it's for 2 reasons. One is the interdisciplinary approach, but also when you bring insights from humanities and from what we call the human-centered disciplines, you get a broader analysis of the impact of technology. And that's the goal. Again, going back to my question of the value. If the question is value of ethical commitment to the public good, then that's where we start. Not that X number of jobs are going to go, so learn another skill or you're going to perish. That's the message our younger people are getting all the time.
But I think those questions arise from the anxieties of parents mostly,
Yes.
where they want to.
And very legitimate anxieties, right? Because as individuals, we don't feel that we have any control over that. You know why? Even AI right now, our universities are going online. So the whole fall semester would be online, right? So students and parents feel that all this information is coming at them. Suddenly you're going online. I don't know what to expect. I have no control. What am I going to do, right? So I tell students that, well, take control. So yes, you're going to learn online, But how you learn is not entirely up to just the professor.
Yeah.
Right? You have
Yeah.
a way. So you know, one part of the COVID experience is all the different ways in which we are feeling helpless, completely helpless. And it starts from that crisis of knowledge where we feel we don't have the medical science to take care of it, right? So this is where the role of universities and the knowledge community is very important to say, yes, certain things we don't know. But we need to then take control of what we do know. Otherwise, it's just, you know, as Radhakrishnan, to use his words, these disjointed scraps of information which are coming at you and you don't know what to do with it, right? So that holistic connection is what interdisciplinarity gives us, which is why I think it's indispensable now. The question of should we have STEM and humanities married together is not a question anymore.
So that, you know, it was good that you mentioned that you are moving online for at least one semester. So there is a question here where, you know, it's an extremely fundamental question that we are all been toying with. You know, I, for one, have been worried about the future of education as I went through, right? You know, I don't know what it will be. Is it necessary for us to be physically present in universities, for us to get an education? If everything's moving online, is physical presence necessary?
So the question is physical presence necessary?
Yes.
Well, you know, I still believe in human connections. I cannot see, and you know, apart from just the social side of it, we are already seeing lots of impact of isolation, right? It's clearly impacting the elderly who are quarantined and etc. So the mental and emotional impact of total human disconnection is already being seen, right? So can we build, or should we try to build, an entire university experience which is devoid of human connections? I would say no, because the university is not only about just delivering lectures, right? The university is about establishing connections, collaborations, etc. Now, the technology is at a level where we can accomplish a lot with that. But does it completely do away with the need for human connection? I would say no. For the next 1 to 2 years, and given the way this has really scared us about, you know, the uncertainty, do we have to make provisions of creating quality instruction which is not dependent on face-to-face delivery? Maybe yes, we need to keep improving and building our arsenal. Should we have these unforeseen events? Can we continue as a university? Yes, we need to build that. But should we try to do away with human connections? No, I don't think human connections we have no evidence whatsoever to suggest that human connections are dispensable. And one more thing I want to say, you know, during COVID, one realization all of us have had is what we understood as our personal relations, you know, our parents or our children, these are not only personal, there's a social context in which we exist. So, you know, that my mother is 12,000 kilometers away and I cannot visit her is a social issue. It's not my personal choice, right? So if we have to change any of this, we have to build the social connections. It cannot just be by me buying flights 3 years in advance. That is not going to solve this problem. So that's another huge learning from this experience.
Right. You know, one of the things that, you know, when these questions come up, and I've been thinking about it a little, that, you know, earlier universities were the only places where you could get knowledge by being physically present because of lack of technology. They never branded themselves as spaces where, you know, humans can come together and work socially together. There are a lot of add-ons, of being in a classroom setting and discussing it with your peers, physically looking at body language and so on. I think it's time universities rebranded themselves, or looked at what is the purpose of universities themselves. So not just education, not just to give, they're not just purveyors of knowledge, but also purveyors of life skills and how to be around with other humans, for instance, and how to learn values and so on.
And also engagement in their communities, right?
Communities.
So Johns Hopkins, for example, which is at the center of all of this research right now. Johns Hopkins has one of the largest medical research organizations, hospitals, and it's a fantastic university. So they are fully engaged with the community. And I'm forgetting the name, it's called Rebuild Baltimore, something like that, where the university is bringing its intellectual resources and its health related resources to serve the community. And it's there's a concept now, it's old, but I think needs to be given more credit than it has received, is the university as an anchor institution, that the university actually connects the entire community around it to bring its intellectual and other social people resources to serve entire communities. So it's not really about just getting online and delivering your course.
Yeah. No, I think, we have run out of time. I think we are already by now 15 minutes. There are a lot of questions, nearly 43, and every one of them is extremely interesting, right? But then I'll take one last question, and I think we'll end it here. I'm sorry I can't take every one of your questions. I hope the questions that we asked addresses many of the issues that the attendants asked. So the question is, essentially, again, I come back to the first question that was asked. If we see there's been, again, I'm asking this to you as a developmental economist. If we are seeing migration from cities back to their roots, what kind of reverse migration can we expect? This is a question by Mr. Nayak, right? And that reverse migration has to happen, but in what way? What kind of skills will the reverse migration take place?
So first of all, just as a development economist, the conditions under which the migration back to the villages are happening, if there are the conditions of life and livelihood are not there, people are going to have to come back. The question is under what conditions, and skills. I don't think we've even given any thought to when the migrants return, could we have a skill development initiative? And this typically, this would, well, not typically, but historically, this could be the job of universities in rural areas. In the US, there's a whole tradition of extension. When Tagore built his university, that was clearly the idea, that the skill development in the local communities would happen, whether it's agrarian knowledge or any other thing. So I don't think we have even given any thought to that idea that, okay, under these pandemic conditions, migrants are being forced to return and now let's use that situation to do some skill upgradation so that when they return, they would be in a better position, not only for their livelihood, but to serve. Why even skill upgradation? Even the knowledge about the post-pandemic factory or enterprises where they would have to come and work. What kind of distancing regulations would be there? What kind of screening mechanisms would be there? There should be, given that, television is now everywhere, there should be ways even for that education is in a post-pandemic return to enterprises, what do the migrants need to know? But we haven't given any thought to that because, you know, we're still struggling with train fares, which is extremely unfortunate. And then if we could think of education, there's also, as I said, you know, a huge number of children at home, right? Because the schools are closed. And we're already seeing in every part of the world, but particularly in the developing world, huge mental health impact of children who are not able to access school. So that's where we should be working, you know, where the migrants have returned, where the women in their homes are being abused, where the children are feeling. And so who should be working there? I would always say universities. But universities, we have not thought about, well, there's a tradition of universities serving communities, right? But it needs to be a lot more part of the core mission of the universities. And, you know, one thing I've been telling students when they ask me about, is online education is going to be okay, right? I say that yes, because we are bringing the university home. And that has to be the approach to the migrant workers who need skill upgradation, the migrant workers who need to know how to be in a and how to do physical distancing, the children who cannot. How could we bring that home, right? And so really crossing the frontiers and, you know, anything we could do in that kind of bringing the university home model is going to be a huge contribution to this extremely uncertain world.
Thank you. I loved your presentation, especially the reference to Dr. Radhakrishnan's, report and the quotes. I've read all Knowledge Commission reports, but Knowledge Commission are a later invention, but not the early ones. I'd never realized that at the very beginning of our independence, that these thoughts were being articulated, but then not followed through. Because there was a question here which asked, why is liberal arts becoming popular now, not earlier? And and there is a historical context as to that there was this idea of liberal arts from day one, but never implemented.
And Radhakrishnan, who's in this report, also making the proposal for how engineering and medical education would have. He is talking about a liberal grounding, but then we go in this, in this kind of educational mode, which is so professionally overdetermined, that we lose sight of, and this is, Radhakrishnan is actually referring to thousands of years of tradition, which is about not compartmentalizing knowledge, because knowledge is about serving humanity. We somewhere lost track of that. And if there is a moment to recover that serving humanity, bringing the university home, giving people connections, then this is the moment to do it.
Thank you, Professor.
Okay. So, thank you so much. I really, really enjoyed it. And bye.
And bye. Thanks a lot to the attendees. Neeraj, closing remarks.
Yes, thank you so much, Professor Ananya Mukherjee and Santosh, for this brilliant talk today. This is perhaps one of those that has extended, be much beyond the expected time, and we are very glad to see that a large number of attendees are still there, and perhaps only a few of them. Yes, I guess maybe we should be having a 5.1 webinar again for Professor Mukherjee coming up, looking at the response. So thank you so much, Professor Ananya and Santosh, once again. And to our attendees, please do join us on Saturday, May 30th for the next session, which is Leadership During Adversity, where Professor Dishan Kamdar, our Vice Chancellor, would be speaking, along with Advait Mukheja and Shravan Pandit, who are both students at Flame University and an alumnus. So thank you so much once again. A very good evening to all the attendees and all of the panelists, and a good day ahead to Professor Mukherjee. Thank you.
Thanks. Thanks a lot. Yeah,